Hi, I'm Dr. Steve Kalisch. I'm a clinical psychologist here at Lakeshore Bone and Joint Institute. My training was, getting my doctoral degree in San Diego, California, back in the early '80s, specializing in clinical psychology. And oddly enough, at that point in time, I was planning on going into a totally different area of specialization, but my first internship was at what was called a pain treatment center, which I had never heard of before. And without exaggeration, day one of showing up for the internship, I absolutely fell in love with what has now become a 30-year career and passion. Being able to work as part of an interdisciplinary team with folks who've been struggling both physically and personally with chronic pain of all various sorts, low back pain, neck pain, headache pain, from injury, illness, accident, and to help people really get their lives back in so many ways that without coming into that kind of treatment program, they probably would have an ongoing life of suffering and struggling because of all the challenges and the upheavals that pain can throw into people's lives. Well, part of what I truly love about being a pain psychologist is being part of people's journey from suffering to adaptive coping. That truly everybody that is referred to me is coming in part not only because of their physical suffering, but because of how they've suffered psychologically, personally, within the family. In many cases, people are unable to return to a certain activity level, including occupation. And oftentimes, those kinds of life upheavals contribute to a sense of suffering because people have not really been, or they haven't had access to some of the what we know are interventions, resources to help them cope more effectively with some of the challenges now that physical injury has intruded upon in their lives, and to help in terms of education, in terms of skill training, in terms of being able to talk with someone who truly understands what the pain sufferer may be going through, and recognize that there are ways to heal and recover and move forward psychologically as well as physically, and make that journey from a sufferer to someone who's able to cope effectively with some of the ongoing challenges that they may have for the rest of their lives is very gratifying and rewarding, knowing that in many cases pain may be a reality in our lives, but the suffering doesn't necessarily have to be. And learning or teaching people how to find ways to overcome the suffering really is like helping people get a life back that was taken from them because of their chronic pain condition. Here at Lakeshore Bone and Joint, I'll see people coming in from a variety of different precipitating events or circumstances, whether it be a chronic degenerative disease or people who have been through a horrific industrial injury, motor vehicle accidents, slips and falls that in their own way have really contributed to musculoskeletal ailments and have persisted to the point where now it's really begun to take its toll on the person's emotional state. Oftentimes people are having secondary insomnia or sleep difficulties because of pain. Having chronic pain is stressful, okay? And that stress from having pain circles around immediately and actually makes the pain worse. So we're caught up in what we refer to as the pain stress cycle. So a big part of what I have to offer to people right from the get-go is identifying ways to reduce some of the stress that people have experienced because of pain that's been circling back and actually making their pain worse. So oddly enough, working with me actually helps to reduce people's pain levels because we're reducing some of the pain that's been caused by the stress of having the pain. And so whether, I'll see people as young as 14 all the way up to, I think the oldest person I've seen here so far has been in their early 90s. And irrespective of age, we know that pain is something that could really tax people's abilities to cope. And coming in and working with me, sometimes people will come in and they'll say, oh, I'm seeing a psychologist, my doctor must think it's all in my head. And I will say, absolutely not, okay? But clearly, there are things that I can teach you to add to your current repertoire of coping skills, things that you had known before, okay? That will include the way we think about pain, the way that we react to pain. That has a lot to do with our brain and our thought processes and our emotions and our behaviors. So yes, recruiting the psychological side of things actually can make a tremendous difference in terms of how we're coping with some of the physical challenges. And so, whether it be back pain, neck pain, pain from amputation, what all those different kinds of pain have in common are what we call the biopsychosocial, which means the medical, the psychological, the social, or the interpersonal challenges that come our way that oftentimes are overwhelming for people. And to come in and help teach people new skills, give them new information that they hadn't had before, is part of the empowering process that comes from entering pain psychology services. Well, hopefully when someone gets referred to me by their physician, coming in and meeting someone new for the first time, especially a psychologist, can be quite uncomfortable. But I think one of the major services I have to offer is giving people education, skill training that they had never been exposed to before. So coming to see me is really an opportunity to get connected with something that they had never had before. That could be truly a difference maker, especially in terms of how they're currently coping with the physical challenges, the situational challenges that are all part and parcel of their pain condition. For pain psychology services is really getting access to an introduction to totally new skills that they had never been aware of before that could be difference makers. One of my big passions in life is playing tennis. I also love to sail. I love to do things outdoors. I've always been a real physically active person because I think there's a lot of not only value in taking good care of ourselves physically, but also for me it's a wonderful form of stress reduction, life enrichment. Other things that I like to do, kind of unrelated to work, is I love movies. I love just hanging out with friends. I don't get to travel that much, but hopefully one day I will, and that's something I enjoy doing. So it's mostly, I think, on the recreational side. I like a lot of physical kinds of activities. Well, I gotta say, and this comes straight from my heart, and I've worked at a lot of wonderful institutions over the years. A lot of institutions that have been nationally recognized as centers of excellence. And to find Lakeshore Bone and Joint years ago, oddly enough, I learned more about the organization because of a injury that my father had sustained, where he was taken to the ER, and one of the docs on call in Valparaiso, Indiana, where we live, was one of the docs at Lakeshore Bone and Joint, and his care and his outcomes were second to none. And I had worked in Chicago for many years, and I actually approached the organization, learned more about it, and really requested if I could be part of what I thought to be a center of excellence right here in Northwest Indiana. I am so proud to be a part of this group and a member of a team that I think from all various aspects has a supreme commitment not only to clinical excellence but truly to patient care. You know, oftentimes we hear about organizations and how they take care of people, or we take care of the total person. But here, it really, those words are enlivened by what we really do with folks. Not only the clinical excellence, but the collegial camaraderie and the sharing of our own specializations put together in ways that really all speak to getting the best treatment and outcomes for patients that come our way in a very caring and genuine kind of way. And I just can't say enough about this organization and how proud I am to be a part of it.